So what do if you find a concern on the first part of your mapping in the measurement part? What if you have a cat in the gutter that you're concerned is going to leap out and cause a heart attack and stroke, or other concerns are found? Or what do if you have a family history that scares you? Your father maybe had a heart attack in his 50s. Your mother had dementia in her 70s. Or there's cancer in the family. Are you destined to follow in their footsteps and go down the path of disease? Well, the answer is no. But in order to identify if there's a problem going on, we need to do an assessment. That's the A of MAP. An assessment is assessing for the root causes of disease. Well, what do I mean by root causes? Well, just like the roots of a plant are beneath the surface of the earth, root causes of diseases of your health are beneath the surface of your awareness. They're there, they're causing problems, they're the engine, that silent engine running leading towards disease, but you have no idea. You don't often feel them. You have no idea they're going on unless they're found and addressed. So what are these root causes of disease? Well, some of them are obvious, and you're well aware of those. Things like smoking, obesity, cholesterol problems, high blood pressure. Those are obvious root causes of disease that most people are aware of. But did you know that periodontal disease is a significant risk factor for cardiovascular disease and other problems? When your gums are inflamed and infected, it can lead towards some of these conditions. Other things like sleep apnea. Sleep apnea is a powerful one and is much more common than most people realize. And it's not innocent. It's not just an annoying thing that happens. It drives many of the mechanisms that cause disease. Insulin resistance. That's probably the most important one. Insulin resistance is the mechanism that ultimately leads to diabetes. Diabetes is just a statistical diagnosis, a bunch of numbers that get up to a level that meets the criteria of diabetes. Insulin resistance begins 15 to 20 years before diabetes. And I was humbled a few years ago when I started this health mapping process to find many people who had disease, and I've been reassuring for years that they were doing okay. Their cholesterol was okay, their blood pressure was okay, their weight was okay, but they had abnormalities on their IMT ultrasound. And in the vast majority of cases, it was because they had insulin resistance and it was leading towards more disease than I had realized. So we have to identify that and treat it if it's there. Other root causes of disease are other sources of inflammation, like rheumatoid arthritis, psoriasis, that's an inflammatory condition, migraine headaches, things like women's health things. If you've had preeclampsia during pregnancy, or if you've had polycystic ovary disease, if you've had breast cancer treatment, those are all risk factors for disease many people aren't aware of. Anxiety. A person who has the hormones released during anxiety reactions throughout their lifetime are at higher risk. So there's a whole host of these root causes of disease that we assess for, and if identified, we treat. So what do you do if you find a root cause? There's a plan. The P of mapping is plan. Measure, assess, and plan. It's not a cookie cutter plan. It's taking your problems that you have, you as an individual, you as a one person, identifying what's going on with you and proposing a plan. And that plan involves, yes, lifestyle changes, that's critical, but with the assessment we can identify which lifestyles are most important. I've told many people taking care of their mouth is more important than losing weight. It really helps to focus where the lifestyles need to be addressed. Yes, it involves pharmaceutical medications. Some of the medications available will prevent against that cat in the gutter from leaping out and killing you. And it involves some supplements too. Some of the supplement industry gets a bad name, but there's a handful of them that are really good. So what we were able to do is through measuring, through the assessment, offer you an individualized plan that will help to, in many cases, stabilize or even reverse disease that we identify. So it gives you an opportunity at more good years.